The Civil Society Network on AIDS, Tuberculosis and Malaria believes that sustainable health financing and improved access to treatment remain critical to safeguarding public health in Anambra State. At the roundtable, stakeholders stressed the need for the government to scale up interventions, particularly at the community level, to reduce new infections and strengthen healthcare delivery. They also urged stronger partnership between civil society groups and the government to ensure accountability and better service delivery. The project, implemented in 5 local government areas of the state, aims to strengthen community-led monitoring, improve service delivery, and promote accountability in the health sector. State coordinator of the ATM network, Ifeyinwa Onachukwu, lamented that resource mobilization for the program is still very limited, with a heavy dependence on donor funding. She noted that the absence of clear budget lines for TB, HIV, and malaria programs within local government health allocations has made the situation even more fragile.
We have a framework that that encompasses the disease data, all disease areas in Nigeria, the data, the processes, the procedures, budgets, how to make money outside government, involve the private sector, involve development partners and all these. But Nigeria will have to own it first, and CLM is a part of it. That's why it has one whole strategic framework.
Onachukwu disclosed that the project has already achieved tremendous results in the 5 focal local government areas it covered, but warned that without sustained government commitment, funding and accountability, the gains can quickly fade. She called on all stakeholders, especially the government, to rise to the occasion and ensure that the fight against TB, HIV and malaria in Anambra State remains strong, community-driven and sustainable.
Financing strategy should be developed, drawing support not only from the state and local governments, but also from the private sector and philanthropic actors. Equally, it's important for the state government to demonstrate political will by consistently fulfilling its counterpart funding obligations for TB, HIV, and malaria programs. Improving service delivery requires stronger community-based drug distribution systems and more deliberate campaigns to reduce stigma and misinformation. Most critically, government ownership of the community-led monitoring framework must be established, institutionalizing CLM within the State Primary Healthcare Development Agency and integrating its findings into health sector planning and performance reviews will go a long way in sustaining the process.
State Program Officer of TB Network, Onyekachi Oluolu, stressed the need to institutionalize community-led monitoring within the Anambra State Primary Healthcare Development Agency. He believes that integrating community findings into health sector planning and performance reviews will help sustain progress made in disease control efforts.
The commitment and efforts of the CBOs and the CLM and the partners in Anambra State, we can make good to say, contributed to the recruitment that have been done back to back in Anambra State. We can also say one of the broader success stories we have gotten as a result of our work is the turnaround maintenance work that is going on in different facilities, because we have seen that the states of these facilities are actually needed attention, and these are what we always call to the attention of the government actors.
Oluolu highlighted the successes of the project in the state, attributing them to community mobilization and empowerment. He stressed that sustained government commitment is crucial to maintaining the gains. Lawrence Mwimo, Signature TV News.